You don't go out and stockpile it. Huh?
Correct.
All right. Dr. Crossman, let me pose this to you. Someone wanted to know whether you can get tested as you're going through this to determine whether you have H1N1.
Okay. There are two tests available. One is called the rapid flu test, and many doctors are doing this in the office. Unfortunately, it's neither accurate nor terrifically helpful. If it's positive, that would mean you have a flu of some sort. If it's negative, it means you might have a flu of some sort. So neither we nor the CDC recommend that. There's an other test that we do in the state laboratory. It's a genetic test that's actually as close to 100% as any test can be, but it takes 3 to 4 days to come back, so it's not very helpful. What we know right now is that H1N1 is out in our community. It's widespread. And if a person has an influenza-like illness, as Dr. Gifford mentioned, there's a 50 to 75% chance that that's swine flu. So really it's a clinical determination made by the physician and patient.
One of the key things I think that all of us worry about is, what if I'm healthy, but my wife is ill, my children, which is probably more likely, the children are going to be ill. What do I need to do in terms of what I do around the house, because I can't put my kids in another room and lock them up for 5 to 7 days until I'm sure they're going to be better. What do you do?
Well, you sort of can lock them up. What you do, we call it social distancing.
Can someone get DCYF on the phone here?
It's called social distancing, and the person who's ill stays in their bedroom, and you have as little contact with them as you need to. So certainly for children, you need to provide supervision. You need to be checking on them regularly, but you don't need to be 1 foot away all the time. 6 feet away gives you a fair amount of protection, and after you have contact with your loved one who's been sick, you do the alcohol-based hand gel, or you wash your hands. And that really goes a long way at lowering the rate of spread from one family member to another. And that being said, if my loved one has the flu, there's really only about a 1 in 4 chance that they're going to pass it on to other members in the household.
Really?
Yeah.
Now that's surprising to me. Only a 1 in 4 chance. Now why is it so low, given the fact that I would think that the communicable aspect of this thing would be much greater?
Well, they're really only very infectious when they've got the fever and they're coughing during that day. And the numbers don't lie. It's basically if I'm ill, one of you would get it if we were that close together for a long period of time, and clearly much less if the duration of contact is less.
Okay, so then the time frame where somebody could pass it on is actually fairly narrow.
Okay, the theoretical time frame a little bit longer. Practically speaking, it's the day or two that you have a fever.
Well, that's good information. So the fever is really the time when you are
most infectious.
Most infectious. Okay, that's very good to know.
So that's why we recommend when you have a fever, stay home.
Yeah.
Until the fever's been away for about 24 hours, then come in, then you can go back to work, go back to school. So I mean, our recommendations are based on the science of what we know about the influenza virus.
All right, what about using a mask?
2 sorts of masks. There's the mask that a surgeon might wear. Putting that on a patient who has the flu protects everybody else. And that's why when you walk into a physician's office now with ILI type symptoms, the first thing they'll do is put a mask on you. That's so you don't spread it to anybody else in the waiting room. That's separate from what a healthcare provider might wear if they were doing a very high-risk procedure. That would be what's called a respirator. It's a very special type of mask. In truth, for most healthcare circumstances, just that regular mask also protects them.
All right, now let's say I'm an individual who has had the flu, swine flu, since that's what we're talking about tonight. At which point do I go back to work?
24 hours fever-free, as Dr. Gifford said. Okay? And you also have to be feeling well enough to go to work. Okay, so it's more than just the number, it's feeling well.
And when you don't have the fever, you have to no longer be on fever-reducing medications.
That's right,
as well.
24 hours as I recall.
Exactly.
After 24 hours. But now,
Can't give your kid Tylenol, have the fever go away, and send them
Yeah.
to school.
but wouldn't that potentially put you back to work within a week of having had the fever?
Maybe within 24 hours of the fever, and we're finding some people feel very well 2 or 3 days after getting sick. The flip side is, thinking about school, your child may be fever-free for a day, but still not feel well enough to go back and interact at school and study. And so don't push them back to school too soon. It's really the combination of being fever-free and not feeling unwell.
Are you hearing any pushback from the calls that you've been getting and from the people you've visited with? Are you getting any pushback from employers who they see the 5 to 7 day period and saying, I don't want anybody back here for a week?
I'll take that one. In the spring, I think there was a lot of pushback as there was a fair amount of ignorance about swine flu. Clearly, as we've come into the fall, there's a terrific amount of knowledge out there, and we've not received nearly that type of negative feedback that we had months ago.
But I think it's also important to recognize that people should not be going back to work too soon. We are a hustle-bustle society. We all need to get back to our jobs to keep the food on the table for our families. We need our kids to be back in school so that they have child care for the day. It's very important for us to all slow down, take a deep breath, make sure everybody is well enough to go back into society, because that alone is going to help to slow how much this virus is going around. The other thing that often comes up too is historically many employers or many schools needed notes from the physician saying that the person was healthy enough to return to school or the child was healthy enough to return. At this point, because the physicians are so busy taking care of the ill patients and answering questions, the recommendation from the Department of Health is that notes are not necessary at this point, that the word of the parent should be enough to the schools and should be enough to the employer that that person is healthy enough to return back to their normal activities.
Here's the probably one of the questions that a lot of people at home are going to say, yes, that's the question I wanted to ask. And a lot of people have asked it. Why is it in schools? And I looked at some statistics today online and it's now available to the folks at home, by the way, through the internet. You can actually monitor the daily attendance records at schools throughout Rhode Island. And I tried that website today, actually this evening, to check to see. And I saw some schools, I think there was one of the schools had almost a 50% absentee rate. A lot of them in the 20s, 15. I saw a lot of those, and some even higher than that. The question that a lot of people want to know is, why don't we just close the schools, at least for a period of time, maybe a week or 2 weeks until we can kind of get our breath, and that will help solve the problem. Will it solve the problem?
We've looked at that. We've talked to infectious disease experts around the state. CDC is the Center for Disease Control. National experts have looked at that. It turns out, while it seems intuitive to do that, because kids are together and they're getting sick, they hang out with each other afterwards, they hang out with adults. It doesn't work as well as everyone believes out there. And there's a problem with it too, is when you close the schools, it really causes other problems to kids, and you actually find kids having other health problems come up when schools are closed unexpectedly for a long period of time. So we try to balance the issue out there, and in the balance, closing the schools right now would not do that. Now, if half or 3/4 or a large portion of the school is out because they're sick, they may have to close just because they can't teach classes, but it's not going to prevent the spread. I mean, once you see that high absenteeism, this virus, the way it's spreading, closing doesn't work anymore.
Well, and there's also a thought too that a lot of kids are staying out. Those numbers that I just gave you, which to me were surprising, that a lot of kids are staying out of fear of getting sick. They're fine, but they're not going to school because their parents don't want them to risk getting ill, right?
That certainly is some of it, but I think everybody recognizes the importance of an education. And so it's best for us to keep our children as healthy as possible, teach them good personal hygiene. They can't control what their friends are doing, but you can certainly control what you're doing. So as parents, if we keep teaching our children to wash their hands frequently, stay far away, 6 feet away from people who are openly blowing their nose or coughing or sneezing, and we can try and keep our kids in school as much as possible.
A lot of people will say, well, okay, I've heard some of these arguments. I'm inclined maybe to get over some of my fears about getting the inoculation for swine flu. How do I go about doing it? How do I get vaccinated? The doctor's offices are full. There's not enough supply. Everything they read probably in the newspaper or see on the broadcasts tell them, can't get it. Love to have it, can't get it. So how do they get it? Who wants to tackle that one?
The Department of Health has done a great job at organizing a coordinated, thorough method of delivering this vaccine. I know it doesn't always feel that way to each one of us as individuals, but as a population-based decision, they've done a terrific job at organizing the school-based clinics, at prioritizing this vaccine as it's coming in weekly shipments that are too small to affect our whole state, but making sure that each weekly shipment is delivered immediately to the people who need it most and who are at most risk, and that is our children and our pregnant women. And with each week, as more vaccine comes into the state, we'll be able to roll out the delivery of this vaccine to more people.